here to talk about Chiari malformation. It is a neurological disorder. We're here also to raise funding and awareness for conquerchiari.org. We have a walk coming up in Beaver Creek, Ohio on September 17th, 2016. It'll be a fun activity for everybody. It's a 5K walk. We invite everybody to come out and spend some time with people that are going through some of the similar situations that you might be going through as well. Right now I'd like to introduce everybody that's here. We'll start right here.
Hi, I'm Teresa. I was diagnosed with Chiari in 2008 at the age of 48. I've been dealing with it my whole life as well, though.
Hi, I'm Sammy. I'm the mom of 2 Chiarians and a little girl too. Okay, this is Jacob. You want to introduce yourself? What's your name? Can you introduce yourself to everybody? Okay, this is Jacob. He's 4. He had Chiari decompression surgery last summer, and this past spring he had tether cord release, which is related. And then do you want to introduce? And this is Ellie.
And then this is Hezekiah. He also has Chiari. Does not have to have surgery, but he still has it. And I'm Josh, his father, Jacob and Ellie's father.
My name's Corinne. I was diagnosed with Chiari in 2004, and I've had decompression surgery twice in 2004 and 2011.
Hi, my name's Amanda. I'm Corinne's mom. I was diagnosed in 2009 and was also decompressed in 2009 and have been caring for Corinne's Chiari and my own Chiari ever since.
Well, I'm glad you guys are here to talk about this so we can share some of our stories and raise awareness for Chiari malformation. I know when my daughter, she was 12 when she was diagnosed, and she was 14 when she was diagnosed, and she has not had to have the surgery. So when she was diagnosed, it was hard for us to find information. A lot of people didn't know what it was. So we're doing this to help raise awareness and also find funding for the research. One of the first things I want to talk about is what Chiari is. Chiari is a neurological disorder that is the cerebellum. Basically, the cerebellum is, I'll just do this. The cerebellum comes down from the back of your brain, and it basically crowds the spinal cord so that the flow of your spinal fluid does not have access to your brain. So it cuts that off and causes numerous different disorders or symptoms. And a lot of people are different. A lot of people have different symptoms. Some don't have any. So why don't we discuss some of the symptoms that you guys have gone through? I know my daughter. I'll start with that. Her symptoms, which made us know that there was something wrong, was she was passing out and she had horrible headaches. So that made us alert and go to the doctor at that point.
I had a lot of balance loss, the tremendous headaches as well, speech problems, trying to find the words to speak, memory issues, a lot of different things like that, pain and numbness, neck, back, hands.
Jacob was born with some neurological quirks, they were called at the time. One of his pupils was larger than the other. He was never able to visually track. And as he grew, we noticed that his balance was poor. There would be times where he'd be running around and he would just vomit. We never really could tell whether or not he was in pain. And it's still kind of up for debate whether or not toddlers with Chiari feel pain or if they're just so used to the pain that they don't know to alert to it. He would headbang on soft objects constantly. And then when he was about 2.5, he started silent speaking and choking all the time, even just on air, which is also one of the danger signs with Chiari, that it's time to have surgical intervention. And thankfully, because of awareness with Chiari malformation and moments like these, we were aware of what Chiari was, and we were able to actually ask our pediatrician to check in and see if he had Chiari malformation. And from there, all of our children were evaluated for Chiari malformation. And that's when we found our older son also had Chiari malformation. Thankfully, our daughter does not. With our older son, he has enough space for his CSF to have plenty of room to go around. But because he does have that herniation, they will continue to watch him as he grows because things can shift. And he does, sometimes he's more symptomatic if he coughs or sneezes or cries. He complains of headaches or running around too much.
Well, a lot of my symptoms were I'd have head pain, my neck would hurt, my back too, and my wrist would hurt a lot, and my legs too, like a lot of things and like, you know.
Well, when Corinne was born, within the first week, I could tell that something wasn't quite right. We called her the princess in the pea at home because she had to be in the perfectly soft place to sleep, and we had to have multiple blankets, lining her crib, and so, not that she slept in a crib, but most of the time I had to hold her. She decided pretty quickly, right at the beginning, that she only ever wanted me holding her. She didn't want anybody else to touch her, not even her dad, really. She started vomiting at about 3 weeks. So every time she would fall asleep, she would throw up everything that she'd eaten. So we went through the traditional GERD studies to try to see if it was, related to gastroesophageal reflux. And they tried to do the test where they put a tube down her nose and test the stomach acid and contents, and she ripped the tube out. And so we didn't get that test done. but we had her medicated for about the first 12 months, and the medication didn't help. She was still vomiting. And so eventually we decided to go against medical advice and take her up to Cleveland Clinic and see what they could find. And so the very first gastroenterologist that we saw there said, hey, let's get an MRI, let's make sure her head pressures are normal. And we went up for the MRI, and before we got back home, my husband had been called 4 times at work and I had been called 3, and messages left on our answering machine, and we thought for sure they found something horrible. They found Chiari, which was better than the cancer that I was worried about. But she was told, we had to go back the very next day, and we were told that she had to have surgery immediately. She had a very significant Chiari herniation. We didn't find out until later, until our third neurosurgeon, basically just in the same hospital, the third neurosurgeon informed us that her Chiari was somewhere between a 20 and a 30 millimeters. And then she had her first surgery. The vomiting stopped after about 3 months. She still has a very sensitive gag reflex, so if she eats something or has to take medicine, sometimes it can be really hard for her. She had some sleep apnea, nothing too serious. She never had to be treated for it, but she did have to have a sleep study, and she snored for a really long time. She doesn't really snore anymore, but she definitely deals with almost daily headaches, daily pain. She does her best to get to school and to do her to do normal things, but she's never been able to play sports. She can't really do the things that she enjoys doing meaningfully anyways, because she'll be able to participate one day and then the next day it's very hard. But in 2009, I was told that there might be a possibility that I might have Chiari also. So I had an MRI, and I also was diagnosed and needed to have, not emergent, but soon, have the decompression very soon. So I had my decompression about 3 months later, and I had a 15 to 20 millimeter herniation, which was pretty significant. So I had vertigo pretty badly, and right before the surgery, I started developing really bad headaches, migraines. So after the surgery, those problems went away, but the structural issues that I have with my back and my neck, that's just going to be something that I just have to deal with for the rest of my life, but that's okay.
As you can see, some of these are the treatment options as far as when you are diagnosed. I know that was one of my big things that were scary for me when my daughter was diagnosed. What are your options once you're diagnosed? So the only way you can tell, as you heard some of the people, is if you have Chiari is through an MRI. So the MRI will show the amount of herniation, which you've heard the 3 millimeters up to, and Corinne's 20, which is a lot. You can see in that picture there, that's the herniation, that's where the cerebellum comes down into the spinal cord. So where it's down, they measure that from the skull line. They measure that down to see the measurement. That's where the how big it is, the 20, the 3, the 5, whatever. And that'll tell basically how far down it goes into the spine that could block that fluid. And then can we go back to the other? There we go. Okay, so the treatment options when you are diagnosed. So basically you have 3 different options. So you have a wait and see. So which kind of is, you're just gonna, it would be kind of like where Kai is at this point. He doesn't have any real bad symptoms. He's just, there's no real problems. We know he has it. We're just gonna kind of see how he grows and develops. And kind of keep an eye on him. He probably will need to have MRIs done every so often just to keep track of his herniation and the CSF flow. So that's your wait and see. My daughter is in the level 2, where we're treating the symptoms individually. She is taking lots of medication. She does not have to have surgery due to the fact that she's able to keep her symptoms under control with medication. Finding that right recipe for the medication, it was a little difficult. It took a lot of trial and error, especially because she was a teenage girl going through, puberty, and that your body changes so much during that time, as I'm sure you'll learn and understand as well. So that's something. That's the second stage, kind of. And then there's those that have to have the surgery. And that's usually based, yes, Jacob had 2 surgeries. So that's basically when the doctor and the family and the patient decide, okay, these symptoms warrant the surgery. My symptoms are higher than, are bad enough to warrant that surgery. So that's when you make that decision. So I guess, do you guys want to all discuss how you came to make that decision?
I decided to do it just shortly after I was diagnosed because the pain was getting too bad and I just couldn't take it anymore. So he went ahead and did it, and it has helped until the car accident last year. And then I started having problems again.
I think it was a simple decision for us with Jacob, only because we had to fight to see a neurosurgeon that knew Chiari. And so when we were finally able to see her, we went to Detroit to see Dr. Holly Gilmer. And we found that even though his herniation was considered small by some neurosurgeons or neurologists who aren't well educated in Chiari, it was completely clogging up his, it was pushing against his brainstem pretty severely and blocking his CSF flow. He'd already had neurological issues from birth, and so it was easy for us to say to trust her that he needed intervention before more damage was done. And it I don't know, it reaffirms too that something we say in the Chiari community a lot of times is size doesn't matter. I mean, you can have a significant herniation that obviously needs attention, but sometimes, with Jacob, it was just a 5 millimeter herniation. And sadly, some children's hospitals even hold to that old standard that is very outdated, that is not significant. But when, it's almost like a cork in a bottle. When you have a very small cork at the edge of a bottle, if it's not really blocking the CSF flow, okay. But when you have a short, fat cork and it's completely blocking up and stopping all of that CSF from getting to his brain, that is a severe issue. And then, of course, with Kai, we trusted her and her decision that, when we were able to see, he's got great CSF going. He's just got a little bit of a herniation, and his symptoms are not severe.
I think too, when we met with her, it was instantly kind of a trust with her. I mean, we knew, we'd seen her reputation, we had read about her online before we went to see her, and so I think it very much put us at ease that she sat down, she pulled the images up, she told us exactly what everything was, and said this is the severity of the issue. I mean, she didn't try to hem and haw around. I mean, she was just straightforward. This is exactly what it is. It needs to be taken care of right away.
Sorry. And she did explain to us, and I think it's important to note, you know, sleep studies with Chiari are a big deal, because sadly, when we lose Chiarians, it tends to be more adult Chiarians that struggle and suffer in their own life. But with the younger ones, a lot of times it's sleep apnea that takes our children, and it was to a point where she said, you know, we're scheduling the surgery if you say yes, and there's no point getting a sleep study at this point because he's obviously going to be having issues. His brainstem is severely compressed. So, and he has had one since surgery, and it was great. So we were very fortunate with that.
So you had also gone to other doctors prior to that one, finding the one. So I just wanted to point out that it is, sometimes you have to go through doctors to find one that you trust and you feel comfortable with. I know with my daughter, I know we did as well. I know we had an MRI done, and that doctor told us that she was 3 millimeters, and he suggested surgery, and we got a second opinion, and the next doctor said, yes, she's 3 millimeters, but she doesn't need to have surgery. So there are doctors that are just jump right in. So you just got to find the doctor that you trust and go with that doctor. Corinne and Amanda, what were your reasons?
I think both times that Corinne had surgery, the decision wasn't really ours to make. When she was first diagnosed, it was pretty severe, emergent. They needed to do surgery almost immediately. They allowed us 2 weeks, but they really wanted us to do it the week that she was diagnosed. So that was kind of really not a choice for us. It was pretty clear that it needed to be done and needed to be done now. Her cerebellum looked like a little triangle. It was so compressed, and she had no flow on either front or back. So, and they were worried that eventually she might need to have a shunt if they couldn't get enough space for her. But the second time, she had a routine MRI when she was 9. She gets them once a year, typically. And when she had that MRI, they found a very large syrinx, which is basically a tube that forms inside the spinal column, inside the spinal cord, that fills with fluid. So when she was diagnosed, she had a syrinx from C3, which was like the middle of the neck, all the way down to T8, which is the middle of the abdomen. So a very significant, what they call tumor. So they needed to do a decompression surgery again to make sure that they could give her more room. As she grew, it obviously got a little tighter. So they needed to do another surgery so that they could prevent more damage to her spinal cord. So that area is permanently damaged. So, and that's one of the things that's really hard, and that we struggle with. I struggle with her, is that when you have this kind of disorder, people can't tell that you're sick. You don't have a cane. You don't have a wheelchair. You look like a normal girl. Yeah. She's a very pretty little girl, and she wants to be normal, but she's not. Every year, as soon as we get our teachers, I have to go in and have a very stern talking to every teacher about, don't you ever tell her no. If she says she needs something, you let her have it, and if not, there's going to be a problem, because it's so easy to look at her and think, oh, she's fine. You know what I mean? And she's really not.
And you smile for your headaches, I'm sure. Yeah. Just my daughter did the same thing. Yeah.
And because of we did have one problem with the pediatrician. Because of the syrinx, she was having phantom nerve pain in her legs, to the point where she couldn't walk sometimes. It was so painful that she couldn't walk. And one of the doctors said, no, that's growing pains. That's not, this is just a pediatrician. And my husband happened to be taking her that day, and I said, oh, why the day that I wasn't there, you know, because I never would have allowed it. Because Corinne was upset afterwards because she was like, Mom, she just didn't believe that I was having this problem. And, you know, it's definitely been challenging for her, but even for me, it really wasn't a choice for me. You know, they basically were a little surprised that I wasn't having worse symptoms at that point based on the imaging. And I was having some pretty severe vertigo and headaches, but, you know, the main problem that we've been dealing with is Corinne, because she's had to really grow up from the beginning having really bad symptoms. Right. And so it's just hard for her because most of the time the most challenging thing is she can't be with her friends. She can't be normal. She can't play games and run around outside without getting sick. And, you know, so we have to have accommodations at school, you know, air conditioning when they don't have air conditioners. We have to make sure she has a water bottle. We have to make sure she can have a rolling bag because she can't carry it on her shoulders. And all of those things put her at a disadvantage because she feels like I stick out. I'm different. And even last year there were some people in the hall that were saying, you know, how come you get a bag? And she, being as shy as she is, she doesn't want to say, well, because I'm sick.
Right.
You know, and so she just kind of smiled and kept on going. But, you know, there's definitely been a lot, you know, to deal with her, but the surgery was just what we had to do it.
Right. That sounds good. I know, and that's another thing that I do want to discuss too, the whole you don't look sick type thing. I know that's hard for a lot of people, and I know especially teenagers growing up, and I'm sure the boys will have as they get older. Because they don't look sick. And, you know, my daughter went through high school. She was diagnosed as a sophomore, and all through her high school, the kids didn't understand why she was missing so many days of school. Oh, you're just skipping school, or, but it's not that. It's they don't have the energy, or they have the headaches and they can't deal with the light. Or my daughter had a really hard time reading. So we had to have a tutor to basically come and read to her because her eyes would dance, is what they call it, and that was from the Chiari. So it's difficult for people to understand what other people are going through, and hopefully raising awareness will open the eyes to people that don't have it to be accepting of those that might have a chronic illness that you don't see. I know there's other ones out there as well. So luckily my daughter befriended a girl who has Lyme's disease, which is, you know, that's another one that is so that worked out great because they understood each other, because it's the same thing. She didn't look sick, but she had a lot of symptoms. So that was the best thing that could ever have happened to my daughter, to find somebody that she could relate to.
People don't talk about too is when you get to be my age and you get diagnosed as late as I did, there's the damage that was done up until that point, because there's a lot of nerve damage.
Definitely.
And
yes.
you know, then you've got all these other problems that nobody's ever going to want to face. The doctors just kind of shrug it off and say no.
Sweep
it's
it under the rug
yeah,
type, yeah.
exactly.
Yeah, I think people aren't as clear about how Chiari actually, how you get it. And we don't even know exactly, but the best description that I've had is that it actually happens before you're ever born, right, in most cases. So the skull forms first, the brain forms after, and the skull's just too small, and that's what pushes the brain, you know, down into the spinal column. But when that happens and all that fluid pressure begins to develop, it can cause all kinds of abnormalities throughout the body. So I have a number of back abnormalities. My sacrum is tipped, my hips are off, my all the way up my spine I've got an S curve, and I've got all kinds of issues with my back. And my when I was in high school, obviously I didn't know, but I played softball, I played volleyball, and I was seeing a chiropractor once a week for my shoulder and my back, thinking that I had a problem with my shoulder. You know, come to find out it was just all this pressure and the tension and the, you know, and so I mean, I guess the good thing with getting diagnosed later for me is that it helped me to help her to learn how to just live with what you have, because I didn't know there was anything wrong with me. I just thought that it was normal. This is what I have to do. And so we've really worked hard at making sure that she, you know, she does her best. You know, there are days, absolutely, and that's the thing I think too that's hard, especially when you have a child in school. She does miss a lot of school.
Oh,
She
yeah.
misses between 25 and 40 days every year.
Oh, yeah.
And the neurosurgeon gives the letter that says, "Hey, she's going to miss a lot of school. That's just it. You're just going to have to, let her miss."
Yes.
And I know that people wonder, but when she misses school, she's in bed all day long. There's no getting up. There's no watching
catching
TV.
up on homework.
There's turning off the light and going to sleep. And she wants so much. I mean, she'll be teary-eyed. She wants so much to go out and play. She wants so much to be normal, but she doesn't get a chance to. Thank God we have Zoe though now, right? She's a dog that
Oh, that's
likes
sweet.
to hang out with her, but
That was one of my daughter's things because the dances. She couldn't. There's no way. All the lights. There's no way. The lights and the loud noise for Chiarians was. I mean, that's just a headache right there.
Yeah. Yeah.
And you're down for 3 days. So that's. I mean, So they planned. That's where befriending the other girl that had the chronic illness as well came in handy because they would go and do something on the night of the dance. So
Right.
that's living with Chiari, a chronic illness or Chiari. So, what have you noticed with your boys that might and with their peers?
Well, we actually, our Chiari is secondary to Ehlers-Danlos syndrome. Unfortunately, I was diagnosed with that and dysautonomia, and that's how I became aware of Chiari malformation. Since then, my daughter is diagnosed with Ehlers-Danlos syndrome and with dysautonomia as well. I'm diagnosed with a tethered cord. I have scoliosis. I'm actually missing a vertebrae and such things. And so we knew from a young age, even before Jacob's Chiari diagnosis, that we were a special needs family. And so we have chosen to homeschool because we knew that we were going to miss a lot of school. And thankfully, I was able to do that. And, most families are not. I was able to do that. So we do a co-op with our school. For school. We've already seen the emotional aspects of it for the boys especially, not being able to do certain games at gym time, no contact sports, certain activities that we've had to say no to. A lot of times it seems like a lot of kid-centered festivals want to have a bounce house.
Right.
We always have to say no to the bounce house or the slip and slide and all of that. And I know that before we came here today, we were discussing with them whether or not they were going to want to talk. And both of our boys were crying about how they didn't want to talk about Chiari, and they hate Chiari, and it was hard for them. And we talked to them a little bit, and they realized that how important it is for people to understand what Chiari is. So,
Well, hopefully with doing shows like this and having the walk, we're bringing some awareness so that those kids, that have the bounce houses, maybe the families will think twice if they have a friend that has, for those birthday parties, maybe they'll have something else for those other kids that can't do the bounce houses or things like that. That's, maybe, hopefully that'll bring some light to that.
I think that conquerchiari.org has been invaluable to our family with finding proper information about Chiari malformation. There's so much misinformation out there, even coming from doctors, and sadly, radiologists miss Chiari malformation a lot.
There's so many doctors who don't even know what it is, and you have to go in and explain it to them.
And that's so frustrating
And,
because they're the ones that went to school to take care of you, and you go in and you have to teach them about the illness that your child has or you have. And that's just very, very frustrating. I know, thankfully, my daughter is in college, and like I said, she is being able to be treated with medications, but she still has to go through the disabilities office to get, she's able to schedule her classes before everybody else so that she has her classes in a location that are close together because she can't spend her day walking across campus because that will wear her out and she'll not be able to go to classes. She, has to, she has access to a tutor through the school as well. So, there's things that they still do in college, which will carry on from high school, and which is wonderful that those opportunities are out there for kids like that, because it is a disability, and thankfully they treat it that way. But some of the tests, I don't know, we talked about the MRI, but I know some of the tests are that you can get to be diagnosed are like the lumbar puncture, the upright MRI, vestibule, oh, that's the MRI you go into, the x-rays, CT scans, the hearing test, vision test. Those are all kinds of tests that they get. This scene MRI is the one where they test the spinal fluid to see if how much it flows. And I think Sam has a pretty good story about that one.
Oh, with Jacob.
Yes, with Jacob.
Thankfully, we have a great pediatrician. Sent us to Cincinnati Children's to see a neurosurgeon. We were not able to see a neurosurgeon, even though we were recommended for one. We had to see a neurologist first. And really, the use of a neurologist with Chiari malformation comes in with pain and helping with such things like that. They don't deal with the actual Chiari malformation. They don't evaluate whether it's surgical or not. So we saw a neurologist who was not a great doctor. And in fact, he told us that Jacob was too intelligent to have Chiari malformation, which is very laughable, as you can see.
Yes.
That Chiari malformation has no effect on your intelligence usually. It can cause brain fog, but that's a little
Right,
different.
that's different.
Yeah. We got a call from the radiologist that his MRI was all clear. I sat with that in my gut for about a month, and it felt so wrong. And so thankfully we sent that out to another doctor, and yes, Jacob Sine, I believe is it Sine?
Cine, I think.
Cine.
Yeah.
Yeah,
As we all pronounce it differently.
We all
Yeah.
it's
We're
like
used to
tomato,
reading
tomato.
more than-
Okay, yeah,
Right.
reading it. Yes, exactly.
His first one, which was done in January of 2015, is okay. He was completely blocked to the posterior of his brain, which is a big deal. He, thankfully, when we saw the proper neurosurgeon, and she ran all the tests that a doctor should run when they find out that you have Chiari malformation, and did a full spine MRI. Another one was done then, and his fourth ventricle at that time was pretty much blocked by then. He had, within 4 or 5 months, his CSF flow had completely diminished almost, which is a very short amount of time. And so we were very fortunate that I trusted my mama gut and did not put up with what that neurologist said. So.
And that's what I was mentioning about finding the right doctor. You just kind of got to go with your gut as far as that goes, and feel comfortable and feel like you can trust them. And I think that's one of the most important things, is finding that right doctor.
When we were explaining to our family what Chiari malformation was, like we would just basically say, so your skull is like a helmet, and your CSF is basically the padding within the helmet, and it lubricates your brain and it keeps things flowing. And so when your brain is herniated from your skull, not only is your brain not fully protected by a helmet, but also you're getting the squishing going on from the skull, which can cause scar tissue to occur and things like that. And then even after decompression surgery, I think maybe we should point out that that is not a cure.
Right, it's not.
Right.
And that your brain is still not in a complete helmet,
Right.
but it's not as squished, and now you can have some padding going back.
Right. Yeah. The decompression surgery is basically to help relieve some of the symptoms.
Right.
It's really only a stopgap. So it basically stops you from getting worse.
Right.
In some cases, people get better. They have the symptoms start to resolve that maybe were the worst symptoms that they might have had. So maybe if you had severe migraines, they get a little bit better. But I can tell you for certain that even after 2 decompression surgeries, Corinne still has
It's not a
plenty
cure.
she has plenty of symptoms in
Yeah,
every
right.
day.
Yeah.
But the goal of decompression, especially when they see on imaging that there's quite a bit of pressure and compression, is to make sure that they stop the nerve damage that will occur either to
Right.
the spine or to the brain if the pressure continues. So that's one of the, when it's doctor indicated, that's what it is. But a lot of people have a lot of symptoms that really need the decompression for as well. So those symptoms might get better, but they're probably not going to go totally away. I do know some people that have said completely resolved, I feel 100% better. But that's just not as often a story that I've heard. I mean, Corinne, you're still having quite a lot of symptoms. Maybe you could tell them a little bit about what it's like for you.
Well, I usually have like back pain and neck pain on like a daily basis, but like some days it's worse than others. It just kind of depends on like what I've been doing. Like if I've been like running around a lot, like my neck will be worse. And like my head, like I'll have like some days like there it's like really bad and I can like not do anything at all. But I usually just have it like it's like a tiny like pain that's like always there, but
Always there.
yeah.
Me too.
Yeah, and she has to have the full spine MRI every time because of the syrinx that she had.
How
the,
often
the
do
tumor.
you have to have that done?
Like once a year.
Once a year.
And it is not a fun scan. That is a long. It's a 2-hour long MRI, and by the hour and a half mark, I'm having to lay on her legs to keep her from twitching.
Oh.
And so she, I mean, I will say she's the most courageous and tough little girl I've ever met. I mean, she puts up with 1,000 things that I don't deal with, you know, pain-wise, and she hardly ever complains. Every once in a while, she'll come in my room and there'll be tears, and we'll both have a good cry, and then we just then we pick it up and we get on it. But you know, in both of her decompression surgeries, she left the hospital way before most kids leave, and she was there only 2 days with her second decompression. But basically, a decompression surgery, for those that don't know, is they basically open up a space in the back of the neck, and they go into where the skull is, and they will actually cut away a piece of the skull bone. It's kind of odd to think of, but the skull actually goes all the way around. So it goes all the way around. So it's a full skull. So they cut a little tiny slice, like a half moon shape, of bone to try to get it away from the brain, so the brain's got a little bit more space. In Corinne and my situation, they also had to remove the first and second vertebrae, the back of it, so that there would be more space created that way. When I had my decompression and she had hers, they did a closed procedure. When she had her second decompression, they needed to open up her dura because she was so tight around her brain too. The dura is multiple layers of like tissue. And so it can be really tight, like saran wrap. So if it's not loosening up on its own, they sometimes have to cut a hole and put a patch over it to make more space. And so Corinne had that procedure done, and I think that actually did help a bit. Some of the pressure headaches that she had definitely got a little better after the second decompression. But some things that do cause complications after the first decompression are a bunch of scar tissue, you know, all over the neck area, which they had to resect and try to clean all that out. So, I mean, like we said before, it doesn't cure you.
It's not a cure, right.
It doesn't, you know, they can't lift your brain back up into your skull. It's always down there, but, you know, it's just, it does help stop the problem. So, you know, where she could have lost the use of her legs if the syrinx had continued to grow, now she's able to walk, but she does have this phantom nerve pain, which is really hard to get people to understand because there's no cause of it other than that she has damage to her spinal cord.
Which is nerve damage.
Right.
Right.
But people, well, it shouldn't hurt her legs, and she can't, you know, and she'll be like, "Hey, Mom, I've got this, you know, I got this pain right here in my, you know, the side of my cheek," and I guess it's just gonna chalk it up to
It's a Chiari thing.
spinal issues.
Something,
Yep.
yeah.
That Chiari, it's always getting you,
Chiari,
isn't it, babe?
Now with Jacob, since he was decompressed at 3, and I think this is becoming more common with the smaller children, is his dura. They went ahead and did open up his dura. Especially at that young of an age, the skull is very likely to grow back. And so a lot of these kids do have to go back in and have multiple decompressions because if they're 3 years old, they just have skull removed. There is less risk of infection with it only a bony only decompression, but you also risk that skull growing back. And actually, they were able to salvage his C2, which we were fortunate for, especially with Ehlers-Danlos, that can make everything loosey-goosey. And it is controversial in the Chiari circle, but she did cauterize his cerebellar tonsils because there was scar tissue damage already. And at that point, they're more of a danger than they are a benefit.
Corinne's were as well on her second
Okay.
surgery. They're so long that they just couldn't see the benefit of not trying to get that, especially because a lot of her symptoms had to do with nausea. You know, just she would get woozy It was kind of like, it's kind of hard to describe because she was under 9 with
Right.
both of these,
Right.
most of these symptoms. But yeah, they did cauterize her tonsils too, because they were just like, they're way down in her neck. We really need to get those up. So
And at that point, and as you know, is when you have Chiari your whole life, you don't know what's not normal.
Right.
And I'm sure even now, even though you've dealt with us for several years, you go through and you're like, oh, I didn't know that wasn't normal. Oh, I thought everybody did that.
Yeah, and I'm learning with my daughter that looking back, you know, she was diagnosed at 14. So looking back through her, you know, elementary years and things like that, some of those things that I thought were growing pains or things like that, it probably was due to the Chiari, and I never put that together until after she was diagnosed, obviously. Well, thanks for sharing your stories. Do you want to take a few minutes to talk about the walk? The walk is coming up. It is in Beaver Creek, Ohio. There,
Sorry.
the walk is done through conquerchiari.org, and it is the walk is held on the same day across the USA. I think that we have 41 states this year, with about 70 walks, and then they're all held on the same day, September 17th. And it's usually, I believe that's the third Saturday every year. Ours will be at E.J. Nutter Park in Beaver Creek, Ohio, and we will start setting up at dawn, and we will be there until about 1 o'clock to tear down. So that's dawn to 1 is our time that we're there. And then participants can come out about 9 o'clock and enjoy a whole day of festivities. We will have a kids tent with lots of carnival games, face painting. Kids can get their hair sprayed purple. We'll have a photo booth, and we will have a bake sale raffle. If you know anybody or have items you'd like to donate to the walk, feel free to contact me at our Beaver Creek Conquer Chiari Facebook page. And then you can just message me on there, and then I will get back to you. And obviously I have donation forms for any tax write-offs and stuff. We need anything we can get. Waters are a big thing for us for the walk. I usually end up purchasing a bunch of them at Sam's, so if you want to just donate money for that, that's fine. We'll do that too. So we get lots of bottled water. We have a DJ come out, so we have that. I know this year we've got a ton of raffle items already. We do have Kings Island tickets for the raffle. That was a big hit last year. So I'm really looking forward to it. I'm trying to think if I forgot anything. Of course, there's the 5K walk, but it's not necessary that you have to go through that. I know some people, especially our Chiarians, that's a little difficult for them. The path is a blacktop path. It's a bike path, so you are able to. It makes it a little bit easier, and you can turn around at any point and come back. So it doesn't have to be a 5K, and you're more than welcome just to hang out and have fun and visit. The main goal is to be able to talk with other Chiarians, so that you can be amongst peers and not feel so alone. Because you have, those people that say you don't look sick. So these people all know what it's like to go through on a day-to-day basis. It affects somebody in their family or affects them personally. And I've had many people come to me and say that they found their doctor through the walk, because of the walk, because they talked to people. We will also be having a small lunch after the walk for the participants. So, and that's all being donated by places around there. So,
and all the proceeds they go to.
All the proceeds will go to conquerchiari.org for funding. And the great thing about conquerchiari.org is 80% of the funds that are raised actually go to the research, whereas a lot of your other fundraiser walks and things like that, a lot of it goes to the overhead to pay for, advertising and things like that. We do all the advertising ourselves, obviously, so Facebook is a big thing for me, so make sure you spread the word too.
Well, I think the research is really important to kind of highlight because there's
Absolutely.
so much that we don't know about this disease. We're maybe not looking to say let's figure out some new way to treat it or cure, but how are all these symptoms playing together? And
that's what I love about conquerchiari.org.
Right.
That's what they focus on, is this, how these symptoms are affecting the people and what they can do to work those symptoms and help.
The brain is so complex. So it's not just that base of your brain. The whole brain is being affected because of the pressure, of the fact that there's less space. So, you could have any number of bizarre symptoms. They won't maybe be like any of the symptoms that you heard here today. Something even just out of left field you would never think. And it could be being caused by Chiari, and that's what this research does. They really look into all of these different ways that we can be suffering, or that potential patients could be suffering. And so the research really does matter.
It definitely does.
So any donations that we can get towards that research can help the next little guy that
exactly.
that gets Chiari, that
or
needs help.
somebody that's diagnosed at an older age
That's
too.
right.
So
Helps everybody.
It does. It helps everybody. One of the things that conquerchiari.org does that my daughter was involved in was they did a 1,000-panel patient research. So she was involved in that. She got to be she was one of those 1,000 people that sent in her MRI and was questioned and did all that, which I think is really great that they're taking people from different communities and just getting all that information. You don't have to live near their research center. They're getting that information and pulling it from all different areas.
They also have educational packets on their website that you can
Absolutely.
print out and take to your doctor, which
Yes.
hopefully they can be, if you're going to a doctor who's humble enough to be open to learning
Yes.
something new. Some doctors don't understand Chiari and they are not willing to understand, and that's when it's time to find a new doctor. But there is
Exactly.
information sheets for schools, for doctors, and all of that you can print out and take.
And that's that was my go-to. I mean, I looked when my daughter was diagnosed, I looked everywhere. I found all these different websites about Chiari and about research and everything. But I don't know what it was. It just stuck out, and it's been amazing, all the things that they've done. And I just really like the way they use the funds and things like that, and the walk. We didn't know. That's why I started the walk, was because we couldn't find any information around here, and none of our doctors knew what it was. So we were like, okay, we need to educate Beaver Creek because nobody knows what it is.
I think that doctors are becoming more aware. I think
Exactly.
that back when Corinne was diagnosed, back in 2004, they were basically everybody in the neurological department, neurosurgeons, were all like, man, this doctor saved your butt, because this does not get diagnosed like this. 22
Right.
months of age does not get diagnosed. And this radiologist did his job that day. And you're just so lucky that we saw it. And so we were really thankful for that. But I think even then, it just wasn't something that was on a lot of doctors' radars. So I think we're really starting to see doctors know, but at the same time, your pediatrician isn't gonna know every possible disorder you could ever
Right.
suffer from. There's so many now, and we're becoming aware of so many more. But so yeah, I mean, it's great to be able to take a packet and say, listen, I know you don't know that much about this, but she's been diagnosed, and here you go, and this will help you understand, and hopefully you'll find the right doctor. But again, if it's a Chiari specific symptom, maybe your neurosurgeon won't even believe that it's Chiari related.
Right.
So you just have to educate yourself, and you just have to know your body, and you just have to you have to be your best advocate yourself.
Exactly. And I know, in talking to other Chiarians helps too.
It does.
To kind of, I know on Facebook and things like that, there's a lot of Chiari groups to share information with and discuss things, so you can kind of know if it's Chiari, kind of deduce yourself too. If it is Chiari related, or if you need to seek additional help.
And you learn more about the comorbidities, because there's a lot
There
to
are
learn
a lot
there.
of different, yes.
And those as well
definitely.
are underdiagnosed and need awareness.
Exactly.
So we help each other through that usually.
Definitely, it's the other disorders that are related to Chiari there's numerous of them, too numerous to count, but.
And they don't really they don't have an exhaustive list yet.
No.
I mean, there's been.
It keeps growing.
Right.
My brother has Marfan's disease, and so there's been a lot of talk about whether Chiari and Marfan's have anything to do with each other, and so because one's a connective tissue disorder and the other one kind of goes with a lot of other connective tissue disorders. So,
Right.
but they just every time we mention it to doctors, we don't know. So, so there's more research that needs to be done even there.
Right, exactly. So, so again, just making awareness and raising funding for conquerchiari.org research, I think, is very important. So, please make sure you get out there and do research, and remember that not everybody that looks like they're not sick are actually, they could be sick. So please take that into consideration if you run across people like that. I want to thank everybody here for coming out and discussing your stories and sharing them with everybody. I think it means a lot, and getting it all out there so that hopefully we can make a difference in at least one person.
Yeah, I appreciate the work that you've been doing with, trying to educate the community. I think that's really, really important, just so that your neighbors and your friends can start to know a little bit about you, so that you don't have to be that walking dictionary of, let me explain to you what's wrong with me, which can be a little frustrating too, because again, we want to try to live normal lives. We want to try to be normal people, be normal teenagers that go to school and, wear tennis shoes and stuff.
Yeah,
but
you don't want to wear a sign that says I have Chiari.
Right. But sometimes it'd be nice if you
Yes.
had that sign because,
Sometimes, yeah.
And the walk is so fun for my little guys because they were able to meet other Chiarians their age. They don't get on Facebook.
Right,
So they don't
obviously, yeah.
connect that way. So when I took Jacob last year and he had his nice new
Oh,
Chiari
he was showing
scar.
everybody.
Yeah, I
It was
said,
great.
there's going to be Chiarians everywhere, Jacob. He's like, really? And he was looking at everybody's scar, and he was showing off his scar. And it was heartwarming because he was able to connect with people that were like him.
Yes, and I think that's one of the main reasons I love doing the walk, and is just so that everybody can get together and just be together, and just see that other people have similarities and that you're not alone.
Yeah.
And I did it for my daughter because she was feeling very alone, as I'm sure you've gone through, and it's hard as a teenage girl. I'm sure as teenage boys, I know friends that help plan the walk. They have 2 boys, and the one boy has it, and he struggles with it too, as far as getting it out there. So, but
And if you even have symptoms and you have a family member with Chiari, they don't understand why it's genetic yet. For us, they assume it's because of the Ehlers-Danlos. They don't know. But I think it's also important to know that even though we still don't understand why it runs in families, that it can run in families. So if you have a sibling or a cousin or a parent that has Chiari malformation and you are symptomatic, that it's always good to get an MRI and check it out, as you learned.
Right. I think it's important to know too, though, that there are plenty of people out there that have Chiari that have no symptoms.
Right.
It's not affecting
Yes,
their lives.
exactly.
It's not hurting them. They're not having damage. You're going to have symptoms if it's severe.
Right.
And like you experienced, sometimes it's a car accident or something like, something traumatic that brings the symptoms forward. There are a lot of people that just live their whole lives and
Without
don't ever
having it.
know.
Right.
I have 5 children, and Corinne's the only one that's ever been tested for it. My other kids don't really have symptoms. I have 1 or 2 that have a couple of little symptoms, but not enough to really test
Warrant
for
that.
yet, because it's a lot to even do the MRI.
all right. Well, thanks again, ladies, and
Thank you.
well, gentlemen, for bringing awareness and raising funds for conquerchiari.org. I hope to see everybody out at the walk on the 17th. I look forward to a very fun and exciting afternoon. Please join us on September 17th for our Conquer Chiari Walk Across America at E.J. Nutter Park in Beaver Creek, Ohio. You can register online at www.conquerchiari.org.